Hi, I'm Steve Adubato. We welcome a longtime friend of the show, Mary O'Dowd, who is Executive Director of Health Systems and Population Health Integration for Rutgers Biomedical and Health Sciences. Mary, good to see you.
Hi, Steve.
It's good to have you. And Mary is also the former Commissioner of Health in the great state of New Jersey. Real quick, tell us what the organization is at Rutgers and what the mission is.
Well, first of all, thanks for having me, Steve. And I'm working at Rutgers in the Office of Clinical and Health Affairs. And much of the work that I do is focused on bringing together the health systems, healthcare and clinical operations, and the public health system. But as you know, Rutgers is a large university, and it has a very broad mission towards educating not only our undergrads across the state of New Jersey, but many of our health professionals across the state of New Jersey as well.
So let me try this. First of all, there's a podcast called On the Pandemic. We'll put up the websites of people that Mary hosts, and she interviews all kinds of interesting folks who understand science and health and the complex issues that we're dealing with around COVID. Let me ask you, as it relates to COVID, the vaccine, and where we are today, 21 months into this, it'll be seen in 2022, early 2022. How much of a role has, quote, misinformation played in making this pandemic and dealing with it that much harder?
Oh, Steve, that's such a tough question. I think that one of the most difficult things that we've dealt with is just the constantly changing information and knowledge that we have on this virus and how to combat it. If you just think about early on in the pandemic, we knew so very little about what we could do to stop the spread of disease. And because of that confusion and the continuous learning, which is both a good thing, but a challenging thing, it has confused what our best strategies are, I think, along the way. So it's our job to continue to recognize that our understanding of this virus and the learning that we're doing is something that's going to change, and explain that as not an unexpected factor.
Is that part of the role of the pandemic on the pandemic podcast?
Yeah, well, so let me just say, Rutgers has been a big player in all of this, right? So they have been on the edge of research, not just doing sort of the clinical operations and responding to the pandemic on the front lines with our physicians and nurses and others, but also doing the research. So they were doing the clinical trials on the vaccine. They developed the first saliva test on how to test for the COVID virus. And so when I was observing this and part of the response at Rutgers University, I was so proud of the contribution that the university was making. We started to talk about ways that we could bring this information to the public. And so On the Pandemic was born out of that sense of pride of the contribution of Rutgers University. And so throughout the course of the last year and a half, I've interviewed a lot of scientists that have done some of this innovative research, but also others who are part of the recovery process. So Pat Hobbs talked about sports and what role it plays in how we recover.
The athletic director at Rutgers.
Correct, yes.
So sports, I interrupted you, but the one thing, I'm going to ask if this is an area you've discussed. As you know, in my other life, I do a lot of leadership development. And one of those areas where I do leadership development is with physicians and clinicians. And to me, and I won't get on my soapbox, you can check out our leadership show for that, the connection between leadership and stress is huge. Meaning, for frontline healthcare workers, nurses, doctors, respiratory therapists, they're leaders. But in this pandemic, they've been asked to do things that are unthinkable, that most of us would never do. What is being done to help them deal with that stress, those mental health issues, wellness issues, well past when we were cheering for them in the first year of the pandemic, because it doesn't go away?
Right. I think one of the most difficult situations we've dealt with is the duration of this event. So a lot of the research and understanding about traumatic events like a hurricane have a relatively short moment in time where the stress is strong, and then you go quickly into a recovery phase. We're still in the event now from the pandemic.
Even at the end of 2021, when we're taping, we're still in it. We can't tell ourselves it's in the rear view mirror. It's not.
We're still in it. I mean, just this month, were children 5 to 11 eligible to get vaccinated, which is a big part of our recovery. Vaccination is a really important part of that. But back to our healthcare workers, I think one of the things that we need to do is recognize that all of us, but in particular our healthcare workers and our public health workers, are going through post-traumatic events. You know, they need to understand that we are there to support them and work with them through this. But all of us are dealing with this stress and anxiety, but them most of all, because they have been on the front lines and it's still not over.
Are they seeking the stigma question? Do you think enough healthcare workers on the front lines are seeking the help they need for emotional and mental health issues?
I don't think any of us are. I think that as a broad community, we need to start to think about resiliency and behavioral and mental health support all the time in every environment that we're in. I think there are services available for healthcare workers, nurse to nurse, physician to physician, and those are really helpful, but making them accessible is important, and making people feel like they should routinely participate in these things. And those are formal programs, but I think we can also think about just being kind and engaging in supportive conversations on a routine basis, going all the way into our school systems. I think we should consider routine screening. Kids have been out of school for a very long time. And I have 3 little boys and they're in grammar school right now. And I'll tell you, some of the teachers are telling stories about behavior in school that is a little more challenging than they would normally expect. And so I think a lot of that comes to the fact that many of them missed a year of this normal behavior. So when you're looking at children in school to healthcare workers on the front lines, I think we all collectively as a community need to think about being supportive of one another, seeking healthcare and behavioral health resources when we need them, and just thinking about resiliency each and every day.
Hey, Mary, do me a favor. Give me a minute or less on the book that you and your colleagues are writing, put out by Rutgers University Press. What's the name of the book?
Junctures in Healthcare and Public Health. I co-edited this volume of 12 women leaders, some from New Jersey, who made incredible impacts in healthcare and public health. I think that readers will be interested in examining their leadership from a gender and race perspective, but also in the impact on their lives. I think every reader will be able to relate to someone in this book that made a significant impact on the American hospice movement, vaccines for children, maternal child health, food safety and security. It's a really interesting read. I personally felt very related to Virginia Apgar, who is from New Jersey. Many know her from the Apgar score, which is that first test that babies take when born. But she made an incredible contribution to the issues around newborn screening and prevention of birth defects on the national stage at the March of Dimes. And so learning about these women, the impact that they made, and their leadership style is really impactful to the reader. And I think more broadly, as we learn about how important leadership is in health, as we've gone through these past years and how much of a difference it can make, it's a really thoughtful narrative, I think, about many of these women.
Mary O'Dowd, the former Commissioner of Health, has just a few projects going on at Rutgers right now. And we thank you for your contribution to the public health discourse and getting important information out there in the midst of a lot of confusion and, dare I say, misinformation. It's not editorializing, it's a fact. Mary, thanks so much.
Thanks, Steve.
Great having you. I'm Steve Adubato. Stay with us. We'll be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by MD Advantage Insurance Company, RWJ Barnabas Health, Wells Fargo, Community Food Bank of New Jersey, Johnson & Johnson, Suez North America, the New Jersey Education Association, the Russell Berry Foundation, and by the Adler Aphasia Center. Promotional support provided by the New Jersey Business and Industry Association and by NorthJersey.com and Local IQ, part of the USA Today network.
I'm very grateful that I'm still here.
That's me and my donor when we went to celebrate our first anniversary.
With a new kidney, I have strength.
They gave me a new lease on life.
I'm still going everywhere and exploring new places.
Nobody thought I was going to be here. Nobody.
And I look forward to getting older with my wife. That's possible now.
We're transforming lives through innovative kidney treatments, living donor programs, and world-renowned care at 2 of New Jersey's premier hospitals.
They gave me my normal life back. It's a blessing.
RWJ Barnabas Health. Let's be healthy together.